Good morning. It is so good to be back with you again on this caregiver education program. I just really enjoy sharing this topic with you on communications and empathy. And I see that today we also have some research students looking into the caregivers of adolescent mentally ill. Yeah, that's not easy. That's difficult, simply because teenage years are difficult anyway because of all the hormonal changes. So lovely to have you join us. So let me get my screen up so that we can get started with this. So here we go. This is lesson 6 on communications and empathy. And our goals for today would be, sorry about that. Our goals for today will be, first of all, to communicate more effectively with a loved one who is suffering from mental illness. And secondly, to feel more empathic with our loved ones, because that builds so many stronger bridges when they sense our empathy. And then also to have some practices on reframing using I statements and reflective responses to help us to communicate more effectively, because of course we have feelings that we can look at in different ways. So that's an overview of our lesson goals, and there'll be time for question and answers, practice sessions, and we'll see how it goes from there. This is me, I'm Evelyn, and I'm registered in the UK for my professional work in this area. And in Malaysia, I'm registered as a certified professional trainer. But why am I here? Well, I'm a caregiver too. I can identify with so many of the things that you're experiencing. And so the lesson goals will be achieved through being based on my journey as a caregiver, to let you know that I do identify, I do empathize with the struggles that you're facing. Caregiving is really something that is not easy to do, but very rewarding, as I will share with you. You see the 2 masks over there? Well, what happens with caregivers is very often we're leading our own lives plus someone else's life, juggling the two, balancing them off. And that takes quite a lot of effort. And let's see how we can help with that area. This was pretty much my area of work during my many years of caregiving. And that work was highly demanding, had many deadlines, and had to juggle with many things professionally. And while I was doing that, I was a caregiver for my mother. You see her here on her 90th birthday. She had a good time. We all had a good time. My mother was very stable. She was easy to look after in her personality, but the disease took some understanding, of course. And so now Mom has passed on. She was being treated for paranoid schizophrenia. And I lived with its effects from childhood. So there was no prodromal stage. For me, it was just observation as a child, the many facets of Mom. Her natural self was very gentle, very kind, but there was this disease that would trouble her. And so, and as an adult, I went for caregiver training to learn about the disease and how it affects people, because I wanted to help my mom. And so I learned how to connect with her and other patients too. And I volunteered at NGOs in psychosocial and peer support groups. I recommend those very highly, because no matter what knowledge we have, it really helps to know that there are people who understand, who can help us, give ideas, and provide the emotional support that we need to be caregivers. As Mom aged, I attended psychogeriatric training as well. This is because no matter what age your loved one is at the moment, the bodies will change, perceptions will change, how they process things will change, perceive things will change. as their age changes. So I found that very, very helpful in staying in step with my mom. And mom stabilized emotionally, and she was able to rationalize and behave normally. Those times of agitation became less and less. And in fact, people would say, but your mom is so nice. Are you sure there's something wrong with her? And of course, that's because she was able to manage relationships so well. There are variations in communication styles while caregiving. It's really helpful to understand that mental illnesses and disorders tend to coexist. That means that none of it is a neat little package. So if something shows up, and just find out a little bit more about it and how you can take care of all of the symptoms that you're seeing in your loved one. And we'll address this in the Q&A session times. The thing is, it's not just you and your loved one, it affects the whole family. And we know that we need to manage the relationships with other members of the family as well. Now, when I say that there are variations, there are different challenges. Now, for me, it was the challenge of an adult child of a mentally ill parent, because I had to adjust from being a daughter, the little child growing up, to being my mother's mom. I had to care for her. And that took a mindset change in me. And once I realized that I was more responsible for her than she was for me, the childhood was over, I remember at that time. It helped me to be more realistic in how I related to her. If the mentally ill person is a sibling, then we have to learn how to factor in the fact that some things they can go along with and some things they can't. And how do we empathize with that? But what if the person with a mental disorder or disease is a young one, and you are a parent, or that may not even be young anymore, but still you are the parent? Now that's very, very heartbreaking, because as parents, I'm a parent too, it is very, we would do anything we can to remove this pain from our child. Even if it's a teenage child going through hormonal changes, an adult child going through relationship problems, all that kind of thing. It's very stressful. So caregiving is an art as well as a science. One thing is also quite helpful to learn about is suicide awareness. It is not uncommon for people with mental illnesses and disorders to have suicidal thoughts, call it suicidal ideation. And sometimes when stressors get too high, even caregivers have suicidal thoughts. So it is really very helpful to go to talks and attend seminars on suicide awareness so that we can learn how to mitigate them, how to prevent them, look out for warning signs. There's another unique factor in caregiving, and this is the care home factor. You might be thinking of putting your loved one into a care home temporarily or maybe even permanently if your home life is not suitable. And I'll be very happy to take your questions on what you would like to know about that area, because you're looking at two areas now. You're managing the care home as well as your loved one, whom you will continue to be responsible for. Coping with caregiver burnout is something that's very, very real. On the left are the main causes that why we come up with caregiver burnout. I've been there too. And once I learned the signs of burnout right there in the middle, then I learned how to deal with them, to get help. Prevention tips are really helpful. Now, with all of this great information, we can stop ourselves from getting burnout. We don't need to get there. But what it is important is to understand, are you experiencing any symptoms of caregiver burnout? And if you are, then to deal with it, do not think that, oh, it'll die down. No, it won't. Caregiving is tough, and you really do need to care for yourself and to help yourself to be able to withstand the many pressures that come with caregiving. So our personal goals and better communication is, first of all, to understand but it is not an easy road. I'm a communications specialist, and I know that communication is not easy, even when we share the same language, because something's going on in one person's mind, and the other person may be trying to figure out, now, what is the message being sent to me? So, it is not something that comes easily. Once we accept that, then we can learn how to be more empathic and more tolerant. There are communication difficulties in mental illnesses which are peculiar. Conditions that affect thinking processes are psychotic disorders, severe depression, and mania. That's because there are problems with processing the information, with concentration, and also with memory. In psychosis, the patient is disturbed by voices and delusional thoughts. They feel disturbed and frustrated. They feel insecure and rejected. And as a result, what they want to do, their comfort zone, is just to avoid people, hide themselves, talk less. Most times just remain silent. So what happens between the relationship between the caregiver and the patient is it just becomes one-sided, with you saying, have you had a bath? Time for bed now. Have you taken medication? Let's eat, let's go out, and that person may not respond. So this is real, and so we will deal with that as well during this course. Now, events of mental health on cognition varies. The blue circles are the various areas of cognition, and there you see the different parts of the brain that can be affected. Now, once we understand that, we become less frustrated trying to fix things. So maybe we can't fix things, but we just need to acknowledge that they exist, and what can we do about it? Because what's happening there is distorted thinking, because the cognition has been interrupted, doesn't flow normally. And what is real is that because of the distorted thinking, the person with a mental illness or mental disorder can be abusive. And it's really important to understand that, not to take it personally. They're not disrespecting you, but they are having a really, really hard time. And you need to get support to deal with the abuse. This is the difficulty, because very often we don't want to say that a member of my family is abusing me. And yet when you go into peer support groups and you hear the different stories and you hear about abuse as well, you feel, okay, so I'm not alone. And you form a little group there where you can help each other and talk to each other very honestly, very openly, without stigma. And that helps. So it just helps to reduce the headache, it helps you to feel a lot better. And there is also a place to talk about suicides, thoughts about it, and what to do about it. So these are kind of self-help groups. I really, really encourage caregiver support groups very much. Now, over the years, I have found that there is a hierarchy of caregiving, and right at the bottom, the first three at the bottom there, those are the anchors. But at the foundation is the caregiver and family support, because if that is deeply rooted and very healthy, the rest will flow very easily. So what's the rest then? Peer support from other mentally ill patients and people with mental disorders, therapy, medications, social support from other people, managing oneself. So these are the anchors. Move on to managing relationships as a whole, quality relationships, quality of life. Once a person has good quality of life, they tend to feel better. And when they feel better, they can overcome the symptoms. The symptoms may not go away, but they can be overcome. So that improves social functionality. The person is able to take place in social settings, in communal settings. And of course, right at the top, the apex there is advocacy, where the person is comfortable enough to talk about what are the needs of people in that group that is suffering in the same way that they are, and also to be a peer supporter. Now, these things from 7 to 1 don't happen very neatly. They can happen according to progress and regression. So that is also something for caregivers to be aware of. And so at all times we are coping with risks, but we get rewards too. And I can tell you that the rewards far outweigh the risks that we take, and it really does make us better people and more fulfilled in being human beings as well. So the foundation of caregiver and family support is to take care of yourself, because it's about giving the world the best of you instead of what's left of you. So take care of yourself. Do whatever it takes, taking breaks, talking to people, so that you can overcome all the difficult situations that you feel. Patient education is very important, because then we understand medications, we understand therapies, we are able to give accurate feedback to the psychiatrist or the clinical psychologist on responses to therapy or responses to medication, and then leave it to the professional to make adjustments, because professionals have studied the diseases in depth and would know how to manage, make adjustments, changes if necessary. Now, having all of this knowledge helps us to understand what's going on and to be more empathic. Active listening is a very important tool for deriving insights. And this part is also really important, because your loved one is in a state of altered reality. We need to very often set boundaries, and the boundaries have to be healthy, and not only setting the boundaries, but to make sure that they are met, when to enforce those boundaries, and maybe when not to, when to just pull back and try again later. So all of this is a part of it. That was an overview of what we will be covering in this session. And there will be lots of time to talk to you and hear you and what your personal concerns are. But first of all, do you have, having heard all of that, do you have any questions for me?